Good morning. I have a beautiful patient from Florida who's come to see me for some facial tuning up. And what we're specifically going to be doing is the neck. She's had a number of procedures here, and she has ptotic submandibular glands. People that follow me know that ptotic means ptosis, which means droop. Fancy medical term for that. It's coming from the Greek, I believe. Anyhow, so we're going to be dealing with this. We're going to put some stratis in here because her skin is very atrophic. If we look very closely here, let's get closer. Right in here, we can see this very fine webbing. It's very atrophic. So she needs an element. Think of it like a rug. Rugs don't feel as good on a hardwood floor unless they have a bit of padding underneath. And so she has no padding. We're going to have to put some padding in there, and that is done with the acellular dermal matrix, the stratis. What we're going to do then is fix the eyes, because the eyes have a bit of a downward slope. So I'm going to do a canthopexy. We're going to do a drill hole canthopexy, endoscopic midface to really bring some of that sparkle and that glamorous sort of heart-shaped look to the face, because dealing with facial aging is not just about tightening, it's about volume redistribution, basically repositioning the furniture in the living room. And so what happens is that the mass of the fat here that used to be located on the malar cheekbones starts to come down, and it starts to crowd this lower part of the face. So this needs to be elevated. That's going to be done with an endoscopic midface. And then we're going to complement this with a little revision Weiss mass facelift for the tightening. Of course, my signature 3D lip lift. She had a previous upper lip lift before. And I'm going to do a medialized corner lip lift complemented by a lower VY. Because as we can see here, part your lip there, we start to see the lower teeth. So what we're going to do, the lower VY is done with incision inside the mouth. It elevates the lower lip, helps narrow the mouth to in more accordance with a rejuvenated face, and it pouts out the lower lip in its center part. So it gives you that sensuality. It's what I call the important backup singer for the lips. Any words?
No.
You excited?
Very.
Very excited and nervous, probably.
Mm.
Yeah. Okay, we've got our day cut out. It's all day, and stay tuned.